panelists from Supplemental Healthcare come on here to discuss the continued realities of COVID-19 and look at the future of travel nursing. The team will also discuss what they're seeing now that cold and flu season is underway, as well as what specialties and locations are in demand right now. Joining us is Dan Smith, Division Manager, Andrew Dixon, Assistant Division Manager, Lisa Lawrence, Quality Assurance and Clinical Service Manager, RN, and Katie Dashiell, Content Manager for Supplement. So I'm going to drop off and let them get started.
Hi, everyone. After months and months of managing the pandemic, COVID-19 is still impacting the country and the healthcare industry, as you know, in travel nursing. So we wanted to take some time to discuss what you need to know as a travel nurse right now. So today we have some representatives from our recruiting and quality assurance teams to answer some of your top questions for travel nursing. So like Rachel said, I'm Kate Dashiell. I'm the content marketing manager here, and I'll be moderating our panel today. So just a little background on Supplemental. If you're not familiar, we have more than 35 years of experience working with travel nurses and healthcare professionals across the U.S. And Supplemental Healthcare can help align your personal needs and your professional goals all under one employer. HC has been named Best of Staffing based on real feedback from our professionals on assignment. Our national network of offices connects you with new opportunities in hospitals, home health, schools, corrections, and other settings, in assignments ranging from per diem, short and long-term contracts, and permanent placements. So we have some really great industry experts with us today. So let's go ahead and introduce the team. Lisa, I'll pass it over to you first.
Hi, I'm Lisa Lawrence. I'm a Quality Assurance and Clinical Services Manager for Supplemental Health Care. I have been with the company for about 5 years, and I've been a nurse for about 36. So some of the things I do are make sure that our compliance and quality standards are top-notch to keep us accredited with the Joint Commission. And another one of my duties is to call people and talk to them if they're exposed to coronavirus or have coronavirus, or if there's any clinical concerns that need attention. So it's nice to be able to talk to a nurse as opposed to someone who doesn't understand all of our language.
Awesome, that's great. So next up, Andrew, you can go ahead.
Hi, everybody. I'm Andrew Dixon. I'm an assistant division manager here in the travel nursing office. I've been here at Supplemental for about 4 years now. My job kind of entails overseeing and help manage our region. I also do, recruit nurses as well. I try and keep a book of nurses, as well as helping out our region.
Awesome. Okay, and then last, I'll pass it off to Dan.
Dan Smith. I've been with the company for 5 years. I'm a division manager, so I do recruit nurses myself, but I also help support a team of recruiters who also does recruit for the country. Do everything we can to make sure we give you guys what you're looking for.
Great. So we're going to do kind of just question and answer presentation today. And we're also giving away some of our Worry Less Travel More t-shirts for questions. So if you do have questions as we go, we're going to answer those. So be sure to put those in the chat or on Facebook. So first off, the question for Lisa, with everything going on at the moment, how do you see the healthcare industry being impacted?
Oh, countless ways. The biggest impact is naturally financial. We have a lot of uninsured people out there, and Medicare and Medicaid reimbursements are really looking close to making sure that they're only reimbursing for the things that they have to. So it's really tough to say right now where we're going to be in a few months. COVID is expensive. It costs a lot for personal protective equipment. It costs a lot for extra sanitizing measures. A lot of things that used to be done on downtime are unable to be done on downtime anymore. They have to be done in real time in order to move from case to case. There's also limited services, especially in anything elective, because, you know, as it is, elective means it's not an emergency. So the people who need something that is either cosmetic or for comfort may have to wait a little bit because of the current delays with getting everything sterilized and keeping everything up to our new standard.
Yeah, for sure. I think the elective surgical procedures is a big one that I know we haven't seen as many of those travel nursing contracts just when COVID kind of started. And it does seem like facilities are scheduling more evening and weekend hours to kind of catch up on the backlog. But it does seem too that they'll prioritize outpatient procedures, just prioritizing to leave open beds for more emergent inpatient cases as we get into flu and cold season with COVID-19 still going on. So definitely a lot to consider with that. So next question for Andrew. With the backlog of elective surgeries, what's the current demand for nurses in related specialties around surgeries? And if there are any specific locations you're seeing those in, and do you see that changing in the near future?
Okay, I mean, we've definitely seen an uptick in elective surgeries, and we've seen OR positions, some PACU, some peri-op lead into endo, and all that kind of stuff. It seems to be concentrated in the states that are opening a little bit more leniently in terms of COVID. So Florida, Texas. Even seeing some uptick in Massachusetts and California as well. Those areas that kind of got over the initial barrage of COVID. And obviously, when this first started, there was a lot of cancellations. With the OR industry and anything around that. So in terms of looking forward in the future, I would definitely encourage people to move fast on needs and openings. We are going to see them, and due to all of those cancellations, the market is saturated with operating room nurses right now. So I would definitely encourage for those people that are looking for OR travel assignments, jump on these fast, because there's a lot of people competing for the same job right now.
Yeah, that's really good advice. And we have another question that will be coming up that's kind of related to, if you're not seeing as many travel contracts right now, what should you be doing? So we'll get back to that in a little bit. So the next question for Dan, what nurse specialties are in highest demand right now? And what do you think will be in high demand as we go from fall into winter?
Definitely the ICU, the ER, and the psych are the highest needs that we have right now. We saw a little dip in med surg, but even that's coming back up. So it really depends on the state that you're looking to travel to. We have full go with everything that we're looking at. So it's really going to be state specific, but definitely the ER, ICU, and I would assume the psych would stay high through winter as COVID comes to an end.
And are there any things, I know you mentioned med surg, but are there any other specialties you're seeing less of right now?
Not necessarily. I pulled our needs this morning, so we do have our dips, but everything seems to be reopened. It's really going to be more state specific. What states are fully open, what states are still closed. Those are going to depend on where you want to go. So, but not anything specifically with needs.
Definitely. Okay, so back to Lisa. How is the flu season coupled with COVID-19 impacting travel nursing right now?
Well, no one can say for sure what's going to happen, but it's important to remember that COVID-19 and the flu are actually two different things. Seasonal flu is different than the coronavirus, but both are going to be spreading a lot over the fall and winter. And the most important thing you can do is protect yourself. By doing that, you protect your patients and your loved ones. In our facilities, we're seeing an uptick in staffing because they want to make sure that they have the staff present and available in case there are extra hospitalizations. It's difficult to scramble to get help, but it's easier to have them in place and be ready for anything. A lot of people I know don't particularly want to take the flu shot. They use the flu shot waiver. I'm going to be honest with you. It sounds like this year a lot of facilities are not going to accept a flu shot waiver. They're going to insist that you have the flu shot, or, you know, kind of count yourself out of assignments if you can't. There is an egg-free vaccine available, and I found that out by going to FluView on the CDC's website. It's just a ton of knowledge about any question you could possibly dream up about the differences between coronavirus and the seasonal flu and every other flu. I think that's in the history of time is probably on there. So check it out, CDC FluView, all one word, and lots of good information on there. And it looks like from the graphs that they have that the age group that's going to get hit the worst is the 4-year-olds to 25-year-olds.
Okay, that's good to know. And yeah, I think internally too, just partnering with your recruiter to know what your facility is going to require, as well as just staying up to date on what's going on with all of that, the recruiting team and everyone else can help you out, staying on top of that. So back to Andrew, what states are you seeing spikes in needs right now? Probably mostly due to COVID-19 and those crisis needs.
Right. I mean, right now, I mean, it's always changing. You know, everybody's kind of learning to adapt, you know, week by week. You know, the facilities putting out different orders seem to be changing, you know, day by day. I would probably say right now, a lot of our crisis needs are concentrated in a few different areas. So we got the Southeast, so Georgia, pretty much the entire state of Georgia right now. Has a bunch of crisis needs. A lot of the state psychiatric facilities there that we work with. We saw an uptick around the Midwest just last week in Nebraska, Oklahoma the week before, and then just as of today, we actually heard that Utah is going to be probably, you know, next on the list. I know a lot of our CSMs in the office today were working with the facilities in Utah to try and prepare for that as well. But, you know, like I said, it's day by day. Some are doing, you know, short contracts to kind of counteract that because it is changing and they don't want to cancel their talent. And a lot of others are, you know, sticking with the regular 13 weeks, you know, to make sure that they're, you know, ready to combat it for the, you know, the entirety, basically. You know, as well as, you know, these upticks in crisis rates, we try and work with our, you know, the hospitals we work with directly, which we have a lot in the Midwest, you know, some in Illinois as well. We work directly with the hospital there. They're very good, very, very good at, you know, staffing and making sure that, you know, they're ready for the next, you know, barrage, I would say.
Yeah, so that's all great information as far as like kind of where you're seeing that. So for a nurse, I'll go back to Dan, like how could you decide where to travel?
Well, when you're deciding where to travel, you're going to start with where you're licensed. A lot of the states right now do have exceptions for emergencies, you know. So if you're not licensed in a state like New Jersey, sometimes they'll allow you to come in if you're going to go on a COVID floor. The next thing is, why do you want to travel? I mean, do you want to go help with COVID? Do you want to get away from COVID? You know, what are you looking to do? So as a recruiter, that's really something that we dive into. You know, what are you looking for? What can I do to help support you get an assignment and support you while you're at the assignment as well? You know, so we take a couple different things into consideration, but it's really going to be specific on the nurse as well as the recruiter and where the open needs are. It's the recruiter's job to match up everything for them.
For sure, yeah. So, sorry, go ahead. So yeah, for sure. I think that it definitely depends on the individual, and always take into consideration like the ENLC, what states you can travel within those. So if you are in a member state, there's 33 states that you can be traveling in. And like Dan said, New Jersey is also allowing nurses to practice in the state under their multi-state licensure. They're still implementing the ENLC, but there's a lot of options as far as that goes. And there's also nurses.com, the NCSBN's website where you can check in on your nursing licenses at any time, but working with your recruiter to determine a location based on those current needs and what you're looking for is really important. So, and that will continue to change with the states of emergency that are in different areas. So definitely partner with your recruiter on that one. So back to Lisa. What should nurses do now to be ready when more assignments in their specialty open up if they're not, those really high crisis needs that like ICU or CCU or something?
The best advice I can give anyone is just be ready to go. Some of our job requests come in, and within 15, 20 minutes, there's somebody that's been submitted that's going to get that job. So if you want to be the person who gets that job, I would suggest that you have all of your pre-work done. Get your medical stuff done. Get your profile up to date. Take your CEUs. Get everything. Get all your ducks in a row. The early bird does get the worm. About the last thing you want to do is be still gathering up your profile when somebody else is out packing their bags. So just have everything ready to go, and that's the best thing you can do. Your recruiters are awesome about telling you exactly what you need, and they've got a team. If they can't tell you what you need, trust me, they've got other people who are going to tell you what you need. I see you there, Dan. But yeah, everybody at Supplemental really does work as a team, and their goal is to get you out, helping the patients, helping you.
Great. So yeah, as Lisa said, facilities are really wanting nurses that can start right away. So even if you can't find that assignment right now, it's definitely good to be prepared and use this time to either be doing CEUs or additional certifications, and then making sure everything else is up to date so that you can get started. And yeah, at SHC, we have a great team as far as, partnering with your recruiter, compliance, quality assurance, like everything on the back end to make sure that you're ready to go and know what you need for your next assignment. So back to Andrew. How could someone decide if travel nursing right now is good for them? We kind of talked about that with Dan, but your perspective on that.
I would say it's definitely your personal decision. There's going to be people right now where they see all the COVID, they don't want to be involved in that. There's also going to be people who are wanting to jump and help. So speak with your recruiter. Get to know them, get to know about their experience. They've probably been here, from the start of this pandemic. So they've gone through the highs, they've gone through the lows. They're probably, going to have a good account of every scenario that's out there. I would definitely, encourage, if you are taking that leap and, you wanting to jump into the travel industry right now, during your interviews, ask as many questions as possible. That's the time when you can really find out, what is the unit like in terms of, COVID exposure, what are the safety precautions in place, PPE, all that kind of stuff. So, take that time to really delve, don't be afraid to ask as many questions with the nurse manager or whoever you're interviewing. And then, just on a little side note as well, we've seen a lot of people recently, people that haven't really thought about jumping into travel nursing because they don't have the experience. A lot of facilities nowadays are requiring, at least one travel assignment, some even 2 years of travel. With the COVID going on right now, facilities are a lot more lenient. So those nurses who don't have that experience, it's a great time for them to get that because it's not a requirement by the facility. So there's definitely some pluses to it right now, starting your travel career.
Yeah, that's definitely good to know for people who are maybe considering it, but aren't sure if they should start right now. So that's good to know. So back to Dan with the question, should a travel nurse extend on their current assignment right now?
It's going to be 100% up to the nurse. If you're comfortable where you are, if they have good PPEs, if you have a good routine going to work, you're making good money, extending is a guarantee. If you're not happy at work, I always recommend about 4 to 6 weeks to give us that time to make sure that we have all of our ducks in a row. So to kind of hit on what Lisa said, if an opening does open, we have you first in line. We're marketing you correctly. We make sure that we have all our ducks in a row. All your medical is in. So when that opening comes out, I can make sure that you're first submitted. So extending is definitely a for sure guarantee if you have an option to extend. However, if you don't or don't want to, don't stay, but just give us an option to make sure that we can do our diligence on our end to make sure that you're first in line.
For sure. Yeah, it's always a great idea to keep that open communication with your recruiter so they can help you in that next step if extending is not the option for you at that moment. And back to Andrew, how can a travel nurse stay updated on new needs in real time?
First off, I would say communicate with your recruiter. Your recruiter is going to be the one who is, has real time, access to these needs. You'll see a lot of job postings online that may be outdated just because of the turnover on jobs right now is so quick. It's hard to keep up, with these websites, hard to keep them updated. So having that open line of communication with your recruiter is definitely key. I know within supplemental healthcare, we're very fortunate that we have a lot of direct access to our client service managers who are, the contacts for the facilities. I know in local and in travel offices, we have the ability to walk down there and speak to them directly. They can get on the phone and, call a facility for real-time needs, so just be, as open with your recruiter as possible. And, it's going to be the easiest way to, to find you an assignment that fits your needs, nice and quick.
For sure. And from my team that, is working more closely with like job postings and that sort of thing, as far as the real time, it is the fastest to get with your recruiter because before the job posting comes out, they can know about that or be talking in the facility or anything like that. So great advice there. And then back to Dan, what is our policy regarding guaranteed hours?
Guaranteed hours are going to be 100% facility specific. If we have it, we can put it right in your contract to make sure that you do have the guaranteed hours. Some facilities do put a cancel clause in there where they can cancel you once or twice every 13 weeks. The big thing to remember with guaranteed hours, if they're not in there, is that these facilities want you there to work for their census. So, I always have the conversation where it's like, they're not going to take you there and cancel you every week or every other week. They want you there to make sure that they're able to take care of their patients. So we do everything we can to make sure the guaranteed hours are in your contract if they're in our contract. And if not, talk to your recruiter about that. They're able to get that information for you and pass along as well.
Perfect. And then back to Lisa, what if a nurse is exposed at work and it needs to quarantine?
If you're exposed on assignment, the best thing and the first thing you should do is let your recruiter know. They will immediately let my team know because we've been up until now, we are just slam dunked with anybody who's been exposed, anybody who has symptoms. And we're going to be happy to take care of you. We're going to work with you to get your pay. We're going to work with you to get better. Make sure that you're getting everything that you need and make sure that you're ready to go back to work when you reach all the things that the hospital wants. Some hospitals want you to be free from fever for 24 hours. Others want you to be free for 72. So we can work with you and make sure that you're ready to go. When you're ready to go back to work, they're ready to take you.
Great, that's good information there. And then back to Dan, since we kind of already talked about the terms and cancellations and thinking about having to quarantine, what's going on with terms and cancels currently?
So when COVID first came out, there were a lot of terms and cancels. I think the facilities really didn't understand how to fully grasp it or where they were going to allocate their sources. So if they needed more in the ICU versus the OR, we saw a lot of terms and cancels that way. I think in the beginning, from the beginning to now, the facilities seem to have a really good grasp on it. So we're seeing a lot less terms and cancels when it comes out. Usually they're there for, even if it is a shorter contract, some of the facilities switch to an 8-week contract instead of a 13-week contract or even 4-week contract. So we see a lot less, next to zero, when it comes to COVID related terms and cancels. So I think everybody's got a good grasp on it now. So moving forward, we should be all set.
Awesome. So back to Andrew, is there a supply of PRN contracts right now?
Yeah, I mean, there's always going to be, our PRN needs out there. I would say as a company, the majority of our PRN needs at the moment are kind of focused in corrections, specifically in Virginia, Florida. We're seeing a lot of PRN needs open up. And, if you're kind of looking for that, part-time, you don't want a full 36 or 48 hours. It's another thing that I would, get back to your recruiter, tell them, give them all this information. Perhaps you really do want a guaranteed 24 hours a week. You don't just want a PRN contract, which a lot of the time nurses are looking for. We have no problem going to a facility and asking for a 24-hour week contract. You'll be surprised the amount of times, they will come back and say yes. So, even if you're kind of dabbling in that PRN pool, I would definitely, think about a 24-hour week contract just to, guarantee you some money, that way, basically.
Okay, good to know for those that are thinking about PRN or maybe doing PRN and wanting more from that. So that's good to know. Back to Dan, what challenges do you still see around COVID-19, just given everything?
So where COVID is at this moment, we have a really good grasp on it. But let's be honest, we don't know what's next. As a company, though, and as a team at Supplemental Healthcare, we're really being proactive to make sure we're ahead of the curve. So anything that comes next, we should be prepared for. So the challenges that are here right now, we have a great grasp on, and what's coming next, we're ready for.
Awesome. So those are kind of the questions that we had seen that were kind of popular, and now we're going to open it up for your questions. So if you joined us a little later, we are giving away some Worry Less, Travel More t-shirts. So if you're interested in getting one of those, type a question in for our Supplemental Healthcare team. We did have one question that came in earlier that is from a nurse aide training with the Red Cross who is looking for a job. So is that something that could be a travel nursing related position, or are they better off, looking for something local as a nurse's aide?
Nurse's aide. I mean, I would honestly, are they looking to train with the Red Cross? Is that what they provide, or are they looking?
They're currently training with the
training. I mean, in terms of nurses' aides, we're seeing more of them than we ever did. I know going back to Georgia, in the state facilities there, I think we've probably, and maybe Lisa can advise on this because she has to, I'm sure she's seen a lot of them come through, the QA approval process for Georgia states. I know personally, as our team, I think we have currently probably about 20 to 25 nurses aide working within the Georgia regional. system there, which is almost 95% more than what we ever used to do. So there's definitely a need for them for sure.
I said the best thing you can do is with nurses aid, you need state certification. So the best thing you could do is make sure that your current state certification is up to date, and find out what new requirements you may need if you want to travel to a different state. Some states are great. They say, as long as you're in good standing in your state, you're in good standing here, and others want something more. So again, if you do your homework beforehand, you can be ready for when a position becomes available. And the more you talk to your recruiter, the more they're going to know what you're looking for. So if you're every day saying, I want a job in corrections, I want a job in corrections, and a job in corrections comes up and they don't think of you, well, that's going to be surprising.
And yeah, we'll definitely include our contact information. You can always direct message us like on Facebook or any social media to be connected to our recruiting team. But if you do have any specific questions or just want to get more information, we'll leave our contact info so that you guys can reach out after the fact. So we had another question that just came in. Are the facilities PPE prepared? I don't know if Dan, you want to take that one, or Andrew?
You want it, Dan? No?
It's all you, buddy.
I mean, what I kind of said previously is, don't be afraid to ask those questions in your interview. Find out as much as you can in terms of PPE. As a recruiter, we will always go and ask those questions for you as well and confirm. We'll reach out to the facility, find out their policy, and find out their policy on quarantining. Anything regarding COVID-19 is something we can get for you and pass that along. But yeah, definitely in the interview, ask as many questions as you can.
Definitely reach out to your recruiter. I usually go through a list of interview questions that I try to give to nurses. So when they do have the nurse manager on the phone, they ask specific questions like that. We don't get that information given to us. And sometimes it does take us a little bit to receive that information from facilities. When you get a manager on the phone, that's the best time to ask those questions. And we'll do everything we can in the beginning to get it for you. But sometimes you have the first opportunity when you get on the phone with a manager. So get with your recruiter, make sure that you have a list of interview questions specific about the facility, specific about the place that you're going, any housing questions or anything like that. Anything that you can think of that's going to be your day-to-day is going to be right on the manager. So,
and I'd like to tag on to that the PPE situations have changed. So in other words, something that you learned in nursing school, that you never go from one room to another with the same mask on or the same gown on, that's kind of been re-looked at to address the coronavirus situation. So people are being asked to wear a mask for 5 days in a row and put it in a bag on their in-between shifts. So it's important to change your way of thinking a little bit about the PPE. And the other thing you may need to remember is a lot of facilities do keep it locked up. They'll give you whatever you want, but they make sure that there's enough there for everyone. So if you do need something, please make sure you ask your manager before you just think that maybe they don't have it. They have it. And if they don't have it, guess what? Supplemental has it, and we'll mail it right to your house.
Perfect. So kind of a similar question that also just came in. How are agencies protecting their travelers during COVID-19? I don't know if you guys have anything else to add to other ways we're protecting travelers.
I think we're very responsive as soon as someone comes to us and says that they've had an exposure, they're experiencing some symptoms. We are very proactive. We never say, well, don't quarantine or don't do this or that or be a good soldier and go to work. We want you to be well when you go to work, because when you're well, you're doing your best. We will supply you with some PPE if you let us know that that's what you need. And we're going to watch out for your best interest all the time. We're never going to push you into a situation that's unsafe or unnecessary.
And this whole thing is new. So we've learned as we've gone. And as we've gone through certain things, we've learned lessons to be proactive this time and change how we do things next time. And that comes from our compliance department to our quality assurance department to managers to recruiters. You know, we ask different questions now than we did before. And we want to make sure we're ahead of the curve as well to make sure you guys are protected. You know, you guys are a representation of our agency, and we want to make sure that we support you from here.
Sure. So I think those are the final questions that we had that came through the chat. So we'll be reaching out afterwards to the winner for the t-shirts. And thank you all for joining us. And if you do have questions after the fact, feel free to ask them and we'll follow up. And we'll also include our contact information. So if you do have any other questions, you can reach out to us on social media at SHC Cares. And so with that, I'll pass it back to Rachel to close us out.
All right. Well, thank you guys so much. A lot of great information. I know the topic hasn't died down, but there's, not a lot of information. It still feels like the same information that was going out. So thank you so much for giving us like a little bit more enlightenment on everything and a little bit of new information on it. So thank you guys so much for your insight. And yeah, if you guys have any questions, keep asking in the comments or message them on